Care to chat? Hello and welcome to this episode of the Northern Ireland Social Care Council's popular podcast, Care to Chat. I'm Wendy Austin and it's my great pleasure to host this series and hear the stories of social workers, social care staff and the service users they come in contact with. There's a real sense of cooperation, of team working, and that's actually what we're talking about today. Team health and social care, if you like. With me, Fifi Kourakou, who's nurse manager at Daisy Hill Nursing Home for adults with learning disabilities in Randallstown. That's part of the Town and Country Care Homes Limited. Alex McIntyre is Domiciliary Services Manager with Optimum Care Group. Pauline Shepperd is Chief Executive of the Independent Healthcare Providers, IHCP, home care providers, and she's going to give us a real kind of strategic overview. She's looking a bit terrified at that prospect. And Heather Sleator, Associate Consultant with Independent Healthcare Providers, who has both a nursing and social work background. So great to have you all here. So we have a huge amount of experience round the table, very much in the health and social care area. Social care, we were chatting about this before we actually came into the studio today. It seems to be something, Heather, that people end up doing rather than intentionally start doing, if that's the way to put it. Is that something that you'd like to change?
Absolutely. We really would like people to understand, the general public to understand how vital a role the social care worker performs, undertakes and grows with. And I think now, especially now, we see so many changes. There's so many opportunities within social care that anyone considering coming into this profession, because it is a profession, it isn't just a part-time job or just something that you do for a few hours. It is actually a profession, and we really strongly want to encourage people to think about this, to realise the opportunities there are for them and the very varied client groups that they can work with, from older people to adults with learning disability to home care providers to mental health services. There's so much scope for people, and it's really what our big drive is, to raise awareness of the value and the contribution that social care staff provide our society.
Pauline, you have a good overview of it all in your role as Chief Executive of Independent Health Care Providers. I mean, most of us only come in contact with the social care world, if you like, if somebody needs help. You know, if it's maybe a parent who needs domiciliary care or a young person who needs some kind of assistance. But give us a bit of an overview of why you value social care and why we should value it and maybe take more notice of it.
I think we hear quite often in the media about hospitals and the pressures in hospitals and the difficulties and various things, and it does tend to be hospital focused when you talk about healthcare. Social care, I mean, is a vital element of the health and social care system. And when you look at the number of care homes, the number of home care providers across Northern Ireland, we're talking about a very, very large staff group, possibly, 30, 40,000 people. And when you look at that number of people, I don't think the public fully appreciates that, the role that those people carry out. So social care is vital. And social care, people tend to think, many years ago, it was, people coming into people's homes and lighting the fires for them and, providing tea and coffee or whatever. The roles have developed to such a degree that it's a very complex provision of care, both in care homes and in people's own homes. People now are living in their own homes or in care homes that previously would have been cared for in hospitals. And, the complexity of that care and the complexity of the situations that, staff are going into. People have much more complex needs that are being cared for in their own homes and in care homes. And the jobs have really got very professional. Nurses used to do a lot of the work that now social care staff do. So, the scale of the workforce across Northern Ireland, I think just isn't really understood and isn't really visible. And I think it's, vital for us within the social care sector to actually promote that and encourage people to join the sector and to understand that it is a profession, that it's a good career to get into and it's a good job to get into. And we need to get into schools to actually promote that.
Alex, To take a kind of snapshot, Optimum Care Group, you have people all over Northern Ireland. I know you're based in Newtownards, but right from the Glens of Antrim to the southwest. And what sort of circumstances are the people who work in Optimum Care? What sort of things are they dealing with?
Well, I mean, given the fact that it is so widespread, you know, they're working unsupervised, they're working across different landscapes, road types, you know, from anything from a city centre to a very, very rural area. People can be widespread out. That also comes with different types of people and different communities and, you know, different walks of life, if you like. And, you know, providing that support to people who are sometimes completely isolated, you know, where they don't have any social, you know, footfall, you know, where the staff are providing not only, as Pauline said, that really important health care, but they're also providing that contact, that, you know, that friendship, that rapport, you know, and for their families as well and for other healthcare professionals. The domiciliary care worker is the link in all of those areas between they see this person 4 times a day in the Glens of Antrim, up a mountain road, where they're maybe snowed in. I've had my staff pulled out by farmers in the country, you know, in the snow, in their tractors, and the local community are the ones that are, you know, noticing that those people need help to be able to provide that care. Even in the times in Northern Ireland where we talk about there's road closures for different reasons and things like that, you know, they will part ways to let the social care workers through. But do they really understand the value of what those staff are doing? No, not really. They're doing it for the people that live in their community, certainly, but they don't actually fully appreciate what exactly it is that those staff are needed for. And I think that's what Pauline said. It went from home help, if you like, from bread and butter and, you know, making something to eat, to actually realising, you know, that without these domiciliary care workers or health and social care workers, these people could not stay in their own home and their families would lose a lot of time, because in those rural areas, Wendy, there aren't necessarily nursing homes or hospitals locally. So they would have to be travelling for miles and miles and miles to be able to visit their loved ones. So domiciliary care allows that to happen on their doorstep.
And Fifi, you're in a different area now. You're in a nursing home setting, but a very different kind of nursing home, the kind of nursing home that I'm thinking quite a lot of people listening to this maybe didn't know existed. You're looking after adults with a learning disability, and they range in age from what?
From 18 to 118. Once you become an adult with learning disability, and you're not able, for whatever reason, to remain at home with your family, then, and you have nursing needs, then you can become part of our nursing home. There is out there supported living areas or residentials, but then if somebody has nursing needs in a quite young age, then they become part of our team in our home.
And what sort of services then do you need to provide? You know, if one thinks of a nursing home usually as having fairly elderly people in it, but if you've got quite a mixture of that sort of age range, that must put a different slant on it entirely.
It is. Well, our priority, you know, it's to maintain our residents' safety and well-being, look after their health, but it's also their home. And as you said yourself, working with quite young people, support, emotional support, support their mental health, make sure they socialise, they are part of the community. So our social care workers are doing a lot of that work. They are the people that they're closest to our residents. They look after them. They're the eyes and ears. They know them the best. They are the best advocates for them, because a lot of our clients, they don't have a voice. They are not able to communicate verbally. So the people that know them the best, they are the social care workers that work with them. They can identify early signs of them becoming unwell, which helps, you know, promoting good health. Because they are the ones that they tell you how those people feel, what they think. You know, sometimes they are able to read the cues and communicate their needs. So it's far more than just providing your basic care.
I mean, I'm guessing that one of the real requirements for working in that field is to have an enormous kind of empathy and kindness as well. But there must be a lot of training required too, is there?
Of course, there is a lot of training, but to be able to do this job, as you said, you need to have compassion, you need to have empathy. You're committed, you're flexible. There is training there provided, but most of it comes from experience too. Working every day with clients with learning disability, with people that need care 24/7. You learn as you go along. There is training, of course, there is provided, but I think it's all comes from experience.
It's very much a kind of changing world, Heather, isn't it? I mean, and you said that yourself at the beginning. It's changing for social care workers because of the increasing complexity of the conditions that they're and people that they're dealing with, but also the way that the system works. I mean, there was a time when, as Alex said, you were just a home help, and all of the chat around it was low pay, poor conditions, all of that kind of thing. Whereas now there is more of an acceptance that it is a profession, and that the social care workers are a crucial part of a team. How can you foster that part of it?
Well, I think it comes down, a lot of it can come down to the leadership arrangements within any setting, whether it's domiciliary services or a care home. And when a new staff member comes in, they get a really good induction to fully explain to them, because I think maybe sometimes people come into the role and don't fully comprehend just how the depth and the breadth of it, for want of a better word. So I think that initial induction, wherever they are working, is vital. And then they need good support and good mentorship from not only their management, but their colleagues, the peers that they're working with on a daily basis, which is because I think maybe you can become quite isolated in times, and you need the support of your colleagues 100%. And yes, as Fifi has said, there is training programs, and a lot, staff are required to undertake that training through the regulatory requirements, through our QIA, through the NISC requirements to be registered. But as they develop their knowledge and skills in the role, and their confidence grows, and I think then staff realise, yes, I have a lot to offer. I have an absolute lot to offer. They have a tremendous understanding of their residents or their clients that they care for, because they see them, they have the most hands-on care, they have the most social interaction, and that is so important. Having time to spend with people now, they're busy and they don't have, 3/4 of an hour to sit down, but they can make that initial contact, and that whatever assistance they're giving an individual, that conversation, that engagement, that relationship is so meaningful. And I think that's when staff really understand that what I am doing is providing a meaningful quality of life for someone else.
To what extent is there a problem, Pauline, of the other people that social care workers are involved with, if I could put it like that? Is there a sort of hierarchy? Does the social care worker feel like they're at the bottom of the pile, if you like?
I think that is the case. And I think, I suppose society, Northern Ireland, all of society actually puts nurses who work in hospitals above those nurses and social care workers who work in settings outside hospitals. And I think that's just naturally the way, public think. And it's not until you work in this environment that you start to realise that there is that hierarchy. But I think that has a lot to do with the lack of knowledge or maybe awareness and this is probably what these podcasts are about, are actually creating the awareness that how complicated these jobs can be, and how much they contribute to society, to the economic value, the contribution to Northern Ireland economically and wider.
Because these jobs, I mean, if you didn't have social care workers doing what they do in either domiciliary setting or in nursing homes, then you really, really couldn't get people out of hospital. And so that is what makes everything work, isn't it?
That's exactly right. And it's not only about getting people out of hospital, it's about preventing people from going into hospital in the first place. And the demographics in Northern Ireland are such that we have a considerably ageing population, and we don't have enough young people coming through. And social care is going to need probably about a 40% increase to maintain the current level of provision of care to the ageing population. So we are on a pathway of needing considerably more staff coming into the social care environment. We're in a path to needing an awful lot more work, an awful lot more funding to come into it. And, we want to try and keep people in their own homes as long as they are safe and able to do that, and they feel that they are safe and looked after. If we can do that, if they can't do that, then they move into a care home. But to try and prevent as many people as possible turning up at a GP or a hospital. And we do know that older people, if they're lonely, they turn up as frequent visitors to the GP. They may turn up frequently at a hospital. And, people turn up at hospitals for various reasons. Maybe, nutrition, dehydration, all these things that contribute to a hospital visit, maybe wrong medication. And if we can provide that early and that early intervention, I suppose a worry of mine is that, there's a lot of unmet need in Northern Ireland, and we just don't have the funding or the staff to be able to put in that early intervention. But if we did the early intervention, longer term, we would see the benefits in the hospitals, and we might be able to address better the waiting lists and those other things that are causing difficulties. So it is about social care being the bedrock of the health and social care system in Northern Ireland.
Alex, so you've been involved in the sector for some time, despite the fact that you're clearly still only 21.
That's right.
What about the changes that have taken place, the technological changes? Because there are really big opportunities there, aren't there, for all that sort of connected health thing, to keep in touch with people in their own homes without necessarily having actually to be there.
Yeah, well, I mean, we're moving in different ways now, aren't we? And I think our whole world, I think the pandemic taught us even all how we all did business was we met up for meetings, we did face-to-face, there was maybe 30 and 40 healthcare professionals in a room on a regular basis. And even then, whenever we first started talking about Zoom and Teams, everybody was like, what? How are we going to do that? And now it's just become the norm, so even for us, and we find that that's a better usage of our time. We don't spend time travelling and all those types of things. That's grand. But I suppose there's pros and cons to all of that, isn't there? Because, from a management perspective, it's lovely that a computer system will tell me that someone is okay. But from the other side of that, we're also still losing that positive contact time with that vulnerable person from the health and social care worker. And, I think that as much as we have to embrace change and move with times, there's cost elements, as we've talked about, about the funding that comes into that. And, in the private sector, the funding's just not there. There's no secret about that. I think we hear enough of it on the media to tell us where the money pots are running dry. And so, as much as we can embrace change and try to move forward with time, I am very much an advocate for that face-to-face contact time, that touch and that feel that someone gets, that warmth from the relationship. And I think the thing about it is we said about the value of the role of the social care worker, and you'd said about them being at the bottom of the totem pole, if you like. And, in my days previous to management, whenever I was training, one of the most important messages that I was getting across to my new staff and existing staff was, without you, I can't do my job. Without you, we can't do all the things that we want to do. So actually see the hierarchy of the company, which is usually our triangle, flip it out the other way around, because without all those hundreds of people at the top, there's no point in having all of the rest. So if we can't secure the people into social care and make them feel that this is a valuable, career path, then there's absolutely no point in talking about technology. Do you know what I mean? Because we won't have the people there to do it. Yeah, it's very smart that we can have a Ring doorbell now that tells family members someone has come and gone from their home. But then what they do is they phone the care company and say, was that you that went to my mum and dad's house? Because I don't know that person. So they still need those people, you know, not just the technology, but they need the people that goes along with it.
Fifi, what qualities would you say make an exceptional social care worker? You must have some really exceptional social care workers in Daisy Hill.
We do. To be a social care worker, you need to possess a unique blend of qualities. To be able to do that, the list, as I say, could be exhaustive, but some of them, it's empathy, compassion, the expertise in the work and the knowledge. As I said earlier, they know the residents the best. They are the one that can tell us what's wrong with somebody. Their observational skills, they can tell you everything about the residents you need to know, and this is very valuable for care planning. Able to make a comprehensive care plan and a care plan that provides good care, you need the input from the social care workers that work with the residents every day. They're the best risk assessors. They risk assess every time before every move. They identify danger. They adapt the situation to ensure safety. They are resilient and they are patient because it's important to acknowledge that sometimes they work under challenging situations and under a lot of pressure.
Teamwork and collaboration, that's an interesting one, isn't it? Because in a nursing home setting, everyone's in the same place. So, the team is kind of obvious. I wonder, Heather, how does it work for social care workers who are, like the people that are working for Optimum Care for Alex, who are all over the place? So how do you build that kind of a team then, so that there's the sort of support and rapport and camaraderie, if you like, that would come naturally in a setting when everyone's in the same place?
Alex, I'll be looking to Alex to make sure I'm saying the right things here. But it comes down, primarily you need good leadership. You need a manager who knows how to get the best from their staff. You need excellent communication. You need to be able to respond to your staff, to your worker who maybe is stuck in a field with a tractor waiting for a tractor. So it's so important that the staff member knows they are not alone. And I think it comes to supervision, to regular meetings, to support meetings, to staff meetings, just to let them. I can just stress that the staff need to know they're not alone, that they never will be alone. There's always going to be Alex at the end of the phone or whoever that manager is. And it's the same in a care home. The care home, you come in the morning, you get a handover report. Staff are all very clear about what their role is, what assistance is needed to that particular day. And they come back at various times during the day. I know when I first came into social services, I moved from a hospital setting into a care home setting, and I absolutely could not have done my job if it hadn't been for those care assistants. Hospital, I had the ward sister, I had junior housemen, I had consultants, I had a huge support network. You go into the care home, and whilst the setup is completely different, obviously, from domiciliary, it's you and your team of staff. And I relied on those staff to come and say to me, I've been in with Annie this morning and I don't know what it is, but she's just not right today, But that was all the cue you needed to motivate and to look and see what we needed to do together as a team. So it's knowing that and the staff need to know they can go to their manager at any time about anything, no matter how small, and that their voice will be listened to.
Alex?
Yeah, I agree with everything that we're talking about right now. There was just one thing that sprung to my mind as Heather was talking there, and it was about that middle line. We talk about, you know, the health and social care workers, and there's a lot of focus on the manager, you know, who is usually one person. But there's this whole ream of middle people. And I think as far as professionalising social care as a career, there is progression there. I have an excellent team of coordinators who work, you know, I don't want to say they work with me in my office, and they lead the teams in different geographical areas, and they know their clients and their staff, and you know, they enable the staff to be, they are those people that you're describing that are on the end of the phone all the time to offer that advice, to make them feel supported and guided and listened to, and you know, even if they're having a bad day, to have a vent, you know, or to, you know, sing their praises whenever. And sometimes, you know, Northern Ireland are getting better at giving us nicer feedback. It's not always just the criticism, and that is lovely, but that middle, you know, we've got domiciliary care workers, and then we usually have a team leader or a senior community care worker. Then we have office staff, and you know, so it doesn't just jump from health and social care workers right to management. There's this whole sandwich filler in the middle that also keeps people out of hospital, and you know, they report to district nursing, and they have a great rapport even with the nurses in the community and who don't even work for Optimum Care. So there's this whole big circle happening in between myself and the health and social care workers. And for people, from the amount of people that I've had that have come to work for us that say, you know, well, you know, I just don't want to be a care worker for the rest of my life. And I'm like, well, why would you be? You know, there are so many opportunities, you know, to move on. And people come out of domiciliary care and they go into nursing. People come out of domiciliary care and they go into something else. People stay in domiciliary care all their life and they end up in management or whatever. Or they just stay as domiciliary care workers because that is where their niche is, where their heart is. So all of those things, it's so important to recognise those middle bits, because, you know, that is where the lack of isolation, I think, for a domiciliary care worker comes from, is those middle people.
Pauline, when you look at the sector at the moment, how can we, and when I say we, I'm including other healthcare professionals and in the whole kind of team health and social care, which is sort of where we started, how can they help social workers to feel valued, you know, to get that good feedback, to have their place, if I could put it like that, in the community, and have their place in the health and social care system?
I think, Wendy, it's about what we're doing now, and it's about raising the awareness and, you know, taking every opportunity we can to actually promote what social care workers do. And I'm very aware that families who visit care homes, families who have home care, domiciliary care workers going into their homes, they can see that, they value it, and they completely understand it. But if you haven't interacted with those services, and you know, you're not aware, so there is probably raising the awareness of the wider public. I think there's also about multidisciplinary teams. Alex has mentioned there about, you know, connection with the district nursing. I'm aware, and particularly in home care, that home care workers do liaise with the other professions that maybe complex care needs. I'm aware of multidisciplinary meetings that happen. So I do believe that the wider profession and the wider clinicians fully appreciate. I think it's the next step that we need to make, is making the public more aware, and actually, you know, getting away from that home help description, because we still go to meetings and people talk about, oh, you know, a home help, have you got a home help? And, you know, that's about, you know, changing that perception and moving away from it. So I think it is all about just communication and promoting the job, promoting the career, and getting out and making the voice heard.
I mean, I wonder, to a degree, has the sector been its own worst enemy for a while? You know, we all know what the press tends to focus on, what the media tends to focus on, but part of the reason why they focus on the fact that, you know, what if we want to talk about low pay, you know, not being valued and so on, it's partly because that message was also coming out of the sector, if I could put it like that. So how do you turn that around, Alex?
Well, I think one of the major things is that, we're all very good about talking about the bad, but, we're striving to promote this as a worthwhile, as a profession, and as something that I've said earlier. So many people have said to me, I could never do that. And then when they've been in the job for a very short period of time, they're like, why didn't I do this sooner? And that is a resounding message that comes from new staff of ours. However, we listen to the hospitals, they're bursting at the seams. Oh, there's not enough money. We don't get paid enough. Our terms and conditions are terrible. And the thing about it is, majority of people that already work in this sector, they do what they do. They accept the terms and conditions, but they work for the people. They work for the service users. They work for the cause. But that is when, and I've said before, that is when I valued my staff the very, very most, because when the chips are down, the media is against us. Through the pandemic, we're clapping on our doorsteps for domiciliary care workers or for healthcare professionals and the NHS and all the rest of it. That was short-lived. It was forgotten about and we got back to the negativity again. But what people forget is while all that negativity is going on, these people are still out there doing this job day in, day out. The cogs are still turning with all those terrible terms and conditions that are portrayed. But I think we need to speak to some of those care workers and let things like this be heard to understand why they do what they do. And yes, it can at times feel like a pressure cooker. You do feel like you're in a pressure cooker. However, there's a part of that then that you then not thrive on, but that you come away feeling like, even though my staff went through one of the worst days that we've had today, we pulled together, we worked as a team, we valued each other, we valued the cause, and we got the job done. And that feeling is, invaluable, if you ask me. So, it's getting that feeling across to people. It has to be the emotive side. Our country doesn't do us any favours by portraying the negativity all the time. We're talking about lots of other things that have happened in the health service probably that's been portrayed in a very negative way. Can we shout a wee bit more about the good stories? Because I would really love to hear those, because there are more of those than there are bad. And one of the things that we always say is, why does it always have to get, that something goes really, really bad before there's so much noise made about it? Let's talk about the good. Let's focus on that. And then maybe people start to see that there are, it's a wee bit more of an even balance. And maybe with that would come a wee bit more understanding for the role, as Pauline said, with the other people past the ones that we know of, and the recognition would come naturally.
Fifi, there are benefits in working in social care as well. Obviously, we've been hearing about many of them as we've been chatting today. There are career opportunities. You've all had careers in pretty much that field. There's also increasing diversity now as well, partly by necessity, but partly also people choosing to enter into the whole social care area. They see that perhaps that can be a good work-life balance. When you were talking about flexibility and so on as well. Could you talk a wee bit about that maybe?
We are the ones that should promote the flexibility, because a healthy work-life balance is very important to enable these people to stay in the job and want to be in the job. Should be a very important part of it. Yes, there is a lot of diversity out there. There's a lot more people that come across that become social care workers, a lot of young people that get involved. And then what we need to do, we should celebrate that diversity. We should put across that it is for everybody. Everybody can do the job if they try. They put a bit of effort for it, the right tools, the right training for it. And it's for us to make sure to promote it and promote the diversity and the culture for that. If you make the people feel valued, as if we promote the good, if you go out there and say about the good stories and how valuable is that job, I think more people will come on board with it. But we need to protect that, and I suppose if the more we talk about it, the more we prepare people for it, because they tend to be creatures of habit. So we are used to a certain way of things. So when something new comes in, it needs a lot of conversation and focus on the positives. But that's to start from the core within the nursing home. If everybody supports each other instead of pointing fingers as such, work as a team, and start from lower as such, but also from the top. If the top promotes that, myself as a manager, the nurses include the social care workers in everything, in meetings with health professionals, to keep them as part of a team, show them that their opinion matters. When you listen to people's concerns and you act timely on it, you don't just, you take it on board and you act upon it, you not just hear, but you act, then that makes them feel valued, and then you appreciate everybody's opinion. Workforce at the moment, you have a lot of cultures that they're mixed, and international working staff, it's very important. We have a lot of international workers that work in our care homes, and I'm sure domiciliary hospitals, everything. This is very important, and it's important for us to make sure they feel respected, they feel valued, although maybe their culture is different, it's still important. And help them be part of the team, I suppose. Ourselves, themselves, the families, the service users, all of us just work together.
As you said, Heather, leadership is vital in this, and we've just been hearing how leadership works kind of on the ground there from Fifi. It needs to come, as she just said, from the top, from that leadership section, but also maybe from, maybe a bit more. We never hear from social care workers normally, do we? So maybe we need to open some kind of channel to allow that to happen more.
Well, absolutely. I mean, social care workers are the best advocate for their own role. I mean, there's no doubt. And it's also, I mean, we know that we have a crisis in employment at the minute. I mean, not only in health and social care, but in hospitality, everywhere. So the most important thing, the managers and the settings are recruiting staff, but it's the retention of those staff that is vital, and that starts from the time of interview and right to that person comes through the front doors, because you've got to be able to show them that how much they are needed, how much they can contribute, and it's not just what the care setting can give them, it's what they can give back. And I don't think that people realise to that extent how important they are. I think providers now are very aware of the need, as Fifi said. There's flexible, the work-life balance, health and well-being support is available. Now there's more acknowledgement that it's a stressful environment, and this is what we can do to help. So leadership is key. You've got to be able to retain your staff, and you do that through good communication, good support systems, and listening to what your staff are saying to you, and providing them with opportunities, as we said, to develop. And as Alex has also said, some people are very happy to be an excellent social care worker, but others want to develop, they want to progress. The choice is there, and I don't think that choice was there before. There's a choice for social care staff now.
Look, it's been absolutely fascinating hearing from all of you. Thank you so much for your time and your insights today. Thanks to Fifi, Alex, to Pauline and to Heather. It's been a real pleasure to talk to you. Thank you for listening to Care to Chat. You can catch all the episodes of this and the first series, in fact, on the Northern Ireland Social Care Council website, or indeed wherever you get your podcasts. Please do subscribe and rate us, and of course, tell all your friends and colleagues. Thanks for listening.